Thank you for staying with us on Health Digest. With me, Dr. Mercy Korir, and we're looking at men's health. Before the break, we were talking about how to identify issues of mental health illness in a man and where to seek help and what you need to do when somebody is actually like a risk to themselves or a risk to other people. And to start off this second and final segment, we'll take a few questions from our audience here.
Thank you so much. My name is Edna, and thank you for this very informative session. And indeed, mental health is a very critical issue. And when I listen to these discussions, I'm actually thinking, shouldn't it be classified as an NCD, as an uncommunicable disease? Maybe that way it could gain more publicity and more people would be able to come out and seek the medical attention. Also, I would like to ask, what role do you see the family playing? Because at times, it's the family members who can actually push their brethren, their brothers or their husbands further away. Maybe they would, the stigma itself could even arise right from the family. So what exactly should the family members do? What role should they play to support their own?
Okay, thank you. We can start with Dr. Njagi. Is mental health an uncommunicable disease?
Mental health is a functional disorder. It is not a communicable disease, but it's functional. We would classify it among other diseases like high blood pressure, diabetes, or even peptic ulcers, where you have this, a lot of acidity. So the body or the mind is not functioning the way it should. What I want to say, because we are going to the next stage of the treatment, there are various stages of mental illness. And the person who committed suicide, like we are even told about the cancer, there are various stages. That is in the final stage. And when you try to help people at the final stage, you may not get very far because it's a bit too late. It's always good in terms of mental health to think in terms of prevention. And prevention is better than cure. Let's not wait until somebody is having a rope and you tell them throw this rope away. What I would like to say is that there's a lot of progress in us, even in Africa, because we have come to accept there's a terminology called stress. If you ask anybody, have you ever had stress? They will tell you, I have had stress. And anybody who has got mental illness has gone through a very stressful period. So during that stressful period, we can actually help these people. The other thing I would say is when mental illness comes in, there is a real chemical change in the body. The way the nerves are functioning, they are affected. And we talk of neurotransmitters in the brain, where the levels go down. And when we give medication, we are able to put this person back. So the treatment of mental illness is twofold: pharmacotherapy and psychotherapy. We have to talk to this person, and we have to help them with a bit of medication when they reach that stage.
Okay. Dr. Karanja, she asked about the role of the family, just before we get to the technicalities of the treatment. What is the role of the family in assisting somebody with a mental health problem?
The family is definitely the first line in terms of prevention and also in the management process of persons who eventually get mentally ill. In prevention, in the sense that providing an avenue where people can express their feelings, an avenue where people can identify when you're going out of the norm and they help you come back online, an avenue where they can be able to identify that this person we live with every day has changed and they need help. And when it is still at the early stages, they can actually either provide the support, talking to people actually sometimes helps reduce the stress levels that may predispose you to a mental illness. But now once a person needs treatment, they're able to identify this person is sick, take them for the help, and support them through the process. Because without the social support, taking the treatment might not be that easy for someone who is mentally unwell.
We had another question.
Thank you very much. My name is Nancy Sironga, and I would like to ask two questions, very brief. Suicide is probably one of the extreme coping mechanism of a person suffering from mental health. I would like maybe to hear more of other ways that people try to cope. so that we can understand. And then in terms of access to care, where would you tell people to go and seek for help? Because we know that there are very few places that they can seek for treatment or support. Maybe you could comment on other areas where they can get support.
Yeah, thank you. So people with mental health illnesses will find different ways to cope to their problems or their ailments. And of course, the most extreme one being suicide. But even before they get there, they'll try other venues, say like doing drugs, some engaging in risky behavior, say sexual behavior, extreme sexual risky behaviors. Some would resort to extreme levels of gambling, in as much as they tell us to bet responsibly. We don't have a measure to responsibility, but anyway, all the same, it's still an effect. So such worrying trends, when somebody feels like, okay, I have this problem, but this is my best way of coping, would really raise eyebrows, because if it can't be given a clear-cut line that this is the problem and I should deal with it, say, differently, then becomes a social cycle of addiction, of gambling, of substance abuse. Yeah, because going by the statistics by the World Health Organization, about 800,000 people die annually as a result of suicide, and this is worrying. Yeah, so if you can find alternative methods of coping, and if you ask me, the best way to cope with these issues is to open up about it and go for therapy, other than gravitating towards drug addiction, sexual addictions, gambling, and the likes. It would be easier to tone down these weird coping mechanisms to more healthier ones like therapy.
The family, like you said, is almost everything actually, because the family actually can even contribute to the mental illness. You know, they are what we call family dynamics. Mm-hmm. There's a lot of strained or skewed relationships between man and wife. And there's even comorbidity or enabling. You could be part of the problem. So it's always good, actually, if you are dealing with a person, look at the family also, because the family could be contributing. Yeah. And even when this man is recovering, it is the same family which will help him to recover. So I think let's not separate the man from his family. Let's look at the family and the family dynamics.
So the second question, Dr. Karanja, was where do people access help when they have a mental health problem?
When it comes to mental health, support to maintaining that mental health should actually start at the family level, community level, because this is where now, unfortunately, men don't have these opportunities. Like I said earlier, women will have these groups where they talk to each other, they release their stress, their emotions. But you find that men, they will probably do that in the pub or something like that. But there are some other things that you can do that are preventive, like participating in sports. But in the primary health facilities, we should even be able to find things like counseling. Yeah? When you're feeling a bit unwell, you can just go and speak to a healthcare provider, and just even brief counseling, what we call brief intervention, can go a long way in helping somebody improve their mental health before even graduates to a counseling psychologist. Not everybody who has a mental health problem requires medication. Some majority will actually just need psychotherapy when the condition is not very complicated. And this psychotherapy, this counseling is available at different health facility levels. And now it becomes severe, where it needs now medication and hospitalization, we have both general hospitals, specialized hospitals that offer that, specialists who are in private practice and general practice, and they're accessible. It's just that people shy away from seeking this help because earlier, what we said, feeling like it's a weakness.
Based on the professional counselors, marriage counselors, and the primary healthcare facilities where counseling is done, men rarely turn up for these services. Kindly clear the assumption that you'll find a very nagging woman leading a man into, let's say, hitting her, domestic violence. Is it that assumption that we have several women in mental facilities and several men in the prisons?
Quite an interesting question, and very, very emotive as well. Yeah, so it's still a challenge to get men to access mental health services. And see, even the example she's giving, assuming you have a nagging woman who drags the husband all the way to the therapy room that you must be cancelled and stuff like that. You see, that already injures the ego of a man, because genetically how a man is wired up. They want to be this protector, as Dr. Peter earlier said. They want to be this exemplum or figure to everybody. But then here they're being told that you're the problem, you must go, you must go, you must go. They'll feel like, I'm only being forced to do this. Yeah? And so the moment they get there, they'll feel like, no, this is out. I can't cope with it. Yeah? But if they are indeed spoken with effectively, and I underline the word effectively, then they won't resist. Because slowly by slowly, they'll start accessing health services. And that gives the dynamics that we have, like, say, for example, in Africa and in the Western countries, where the concept of therapy is very much welcome. Whether you're male or female, so long as you have a problem, you have to go and seek it. So if you can change that narrative by effectively communicating with the persons affected, then it becomes easier. Because in the broader perspective, even the family members are equally affected. It's not just the individual who has the problem. When the man is unwell mentally, the entire family is sick. But until he gets well, then can the family be restored back to its former glory?
A final question?
All right, thank you. Okoth Onyango from the University of Nairobi School of Medicine and the Vice Chairperson, Kenya Healthcare Student Summit. Now, my question is as regards the Kenya mental health policy. From the World Health Assembly, I think at the 66th session, resolution number 8, countries were urged to have, mental health policies, and Kenya, we developed one running from 2015 to 2030. And, we have seen from where I stand, I see, like a slow adoption of that policy, because among the factors that were, that were listed, as primary indicators in this policy was the issue of, financing of healthcare treatment, the personnel, the human resource, as well as, the social support. But we have not seen this, being effected well in institutions, as well as, even government offices. I met a case of a student who was referred to a counselor in their campus, but they could not find a counselor because the counselor was on leave. What is it that is lacking in the adoption of this policy in our institutions? Thank you.
Okay. Dr. Karanja, very briefly.
I think as a country, we are moving in the right direction in terms of addressing mental health issues. Like he mentioned, there's already a mental health policy. The implementation might seem to be slow, but I believe there's also a consideration even currently in the universal health coverage that's happening. So we should see more progress in the variety of services in mental health provided. Okay.
We definitely have a long way to go in addressing mental health issues, and I'd like to get your final brief comments on the issue of addressing men's mental health and well-being. And I'll start with you, Dr. Njagi, just very briefly.
I believe we are making progress, but I believe the health department by our government has not been placed where it is supposed to be, because you see, a country means the people, and the health of the people is very important. When you look at the budget the Minister of Health gets compared to even education of the armed forces, it is peanuts. I think we need more input from the government, and the political climate needs to look at the health of people in general and do more financing. I think that is important.
Dr. Karanja, final comments?
Mental health for men is very critical, and we should focus not just on waiting for treatment. We should start focusing on prevention, and then from prevention and promotion of mental illness from the community level, and then when they seek treatment, also we encourage the families to be supportive, and we stop this stereotyping men that they should not fall mentally ill. They're humans, they're vulnerable, but let's support them to have mental health.
Your final comments?
Yeah, I'd urge every stakeholder to come on board and assist in the fight against mental health and the stereotypes around it, so that there is assistance. And so what is necessary is to understand that we need to accept that it's a real problem that exists and it needs to be handled or tackled. Then two, we need to understand the dynamics around it. And eventually, for the ones affected, we need to help them either open up or address them to more easy avenues of getting the assistance. And eventually, even for the government, they should fast track the implementation of the policy, Kenya mental health policy, as he mentioned, because it lies among the 54 countries in Africa which are yet to adopt a separate health budget for matters of mental health. So if that is done from the community level, as Dr. Karanja mentioned, to the government, then eventually you'll see a change in the dynamics.
Okay.
Yeah.
Thank you, ladies and gentlemen, and our audience for this conversation on men's mental health. We're looking at issues around men's health, particularly mental health and their health-seeking behavior, and where help is available. And I think what the panelists have insisted on is that at the core is a family unit, which is the first line of care. And thank you very much, Elma Durigan, who is a counseling psychologist and a life coach, Dr. Mercy Karanja Kibet, who is a psychiatrist at Mathare National Teaching and Referral Hospital, and last but not least, Dr. Peter Njagi, who is also a psychiatrist and former chief psychiatrist at Mathare. Thank you for your valued company. Thank you for staying with us. You can always continue having this conversation with us. You can tweet me at Dr. Mercy Korir, at KTN News KE, or you can mail us at healthdigest@standardmedia.co.ke, and we'll be able to hear what you have to say about this topic and any other health topic that may be of interest to you. That's where we wind up this episode, and we look forward to having you again on our final topic on men's health, and we'll be looking at alcohol and substance use. God bless.
At his age, most of his peers are looking forward to exploring what the future holds, but for Victor Wambua, he is staring at a bleak future. What started as a bacterial infection in the ear caused him his hearing.
This hearing loss has been gradual in that during the age of 2 years when I was young, my left ear got infections, and when the infection occurred, that led me to being hearing impaired. In that case, I had to rely on hearing aids so that I could hear from class 6 up to campus second year, where my hearing deteriorated to a state that I could not hear, or I could hear little to none.
Before he lost his hearing completely, Wambua loved listening to music and he was an ardent fan of movies. But his condition has changed all that, robbing him the satisfaction of enjoying his favorite genre of movies. He had to adapt by developing new interests.
What I do most is writing poetry. Poetry is like a charm. When you feel down and you write poetry, it is encouraging. And due to my condition, I have had to adjust in that I have to do tasks that require less communication.
Sensorineural hearing loss occurs when there is damage to the inner ear or the auditory nerve, the nerve of hearing. Surgical procedures such as a cochlear implant and other medical treatments might be more effective in correcting the hearing impairment. Hearing aids or implantable devices might also be recommended for some patients.
We are only using communication through phones, SMS, WhatsApp, even signs. It has already changed very much, and we wish people of goodwill, well wishers, to help us so that we may come back to our normal life. It's really challenging. Most times we can talk, we can laugh in the house, and the boy is challenged. He more or less thinks that we are laughing. The laugh is all about him.
Such hearing loss may also come with aging, exposure to noisy environments, or head injury. One is advised to see an audiologist as soon as possible. For Wambua, his desire is to get his hearing back and live to his full potential. Mary Mwoki, KTN News for Health Digest.